Does anybody see it?
No, we are seeing the screen.
I can see it.
Oh, really? You are viewing the DDD conference screen.
Do you have an option to view presenter screen or something?
Live sessions. Do you see
Oh,
that?
all right. Here we go. I disabled the screen sharing of the DDD user.
Yes. Now it's fine. Beautiful.
Okay, click on that.
Can other participants see it?
Then
It's a family in Mali.
sessions, and you'll see the
Yeah, we can see it now.
Yes.
Now only you are sharing your screen, nobody else.
Exactly. Now what you want to do is put a pause on that. You see a little box on the left side? Pause that. Block it. Yeah. You see the... Okay, now click on below that. You want to click.
Oh, it looks like Alon is a musician.
One live session below that session, and once you clicked on it, you see that. You're getting it. Great. Okay, so you want to leave that. You want to be in the Zoom with us. Okay. So if you click on the bottom,
Alon, you might want to mute yourself. Alon.
greetings, everybody. Tammy, can you see me clearly now? Is there echoing? Excellent. So welcome to our session. And we are delighted to be here together with so many eminent panelists who've joined us from around the world to discuss the issue of family planning, the issue of population, and of course, desertification. I want to frame today's session before I introduce our esteemed panelists as follows. Desertification was defined over a decade ago by the Millennium Assessment as the environmental problem which affects more people than any other on the planet. It's essentially the loss of soil productivity in the drylands because of mismanagement, generally overgrazing, afforestation and deforestation, poor farming practices, and the like. One of the reasons we haven't maybe addressed this globally in the way we could is because this problem has largely been one which is focused in Africa, particularly in the Sahel. And therefore many countries are not as aware or as committed to it. But we in Israel are extremely aware of the problem of desertification as we are in a drylands country. We're also aware that there are drivers which are direct drivers of desertification, like overgrazing or farming practices, and indirect drivers, which can conclude anything like global markets and land ownership issues, but also issues of population pressures. And that's why we wanted to focus today's session on that issue of population pressures. There's no question about it that in a country like Israel, which also is battling desertification, if our population was more stable, we would have an easier time of it. And indeed, to my mind, when we think about desertification, you go back to the old paradigm of the tragedy of the commons, which is a question of carrying capacity and overwhelming and exceeding the carrying capacity. And so that's the session. So if we want to stabilize populations and allow us to reach some sort of balance, we're going to have to think about population programs and family planning. And that's why we're having this session. And that leads me to introduce our panelists. And I'd like to do that briefly, and maybe I'll do that more as they come in. The first speaker, and we'll be presenting our slides, is Alicia Graves. Alicia comes to us from the Bixby Center for Population, Human and Sustainability at the University of California at Berkeley. She also is the founder of an organization called OASIS and has been involved in a range of programs promoting family planning, reproductive autonomy, female empowerment in the world. And we're so grateful that she could get up early in California and be with us today. So good morning to you, Alicia. It is evening here in Israel, but we are happy to have you. Also joining us from Nigeria, and thanks so much for your patience, Priscilla, is the Special Advisor to the Honorable Minister of State for the Environment and Global President of Women's Environmental Programs from Nigeria, Dr. Priscilla M. Echakba. And I want to say personally what a great pleasure it is, because Priscilla was with us at the very first desertification conferences. And I'm so sorry that the present corona pandemic prevents us bringing you over so we can see you once again, but we will see you soon. And we are glad to have you, even if virtually and even at a distance. Also speaking today will be my dear friend and colleague, Professor Daphna Carmeli Berenbaum from the Haifa University Faculty of Social Welfare and Health. She is a world expert on issues of reproduction and policy, and a member of our Tzafuf board. And finally, will be joining us because she's, I think, in an operation room right now, but promised me she'll be finishing up the patient soon. Dr. Mashira Abudia, who is a physician from Hadassah Hospital and the chair of the Doctors for Human Rights here in Israel. So with that brief introduction, I would ask that Alicia take the floor, and I'm going to mute myself and get us some framing before we go with everybody else. So take it away, Alicia.
Thank you, Alon. Thanks to the organizers and participants for putting this on and for including population and family planning on the agenda. It's often overlooked. So I'm really happy to see it here, and I'm happy to be here. It's not that early and I have my coffee. I'm ready to go. Something that you said in the introduction that I just want to pick up on, one word. You said through family planning, we can ease population pressures on the environment. And actually that is true. And we'll look at how it's linked to some other kind of measures of development. But I want to say the thing about family planning to keep in mind is the easier that we can make it for women and couples to access it, the more likely people are and more able people are to take it up. And so I think, oftentimes talking about family planning, especially in the context of a conservative and often patriarchal society, people get so fixated on all of the barriers, blocking women and couples access. But if we can keep it easy, make it as easy as possible, as affordable as possible, as physically close to where women live as possible, give them the correct information, then we can see really rapid changes in an uptake of family planning. So today, my objectives are just to remind us about the links between population and voluntary family planning. I want to talk about the context in the Sahel. Perfect storm may seem like hyperbole, but I think it's actually very accurate for what's happening there in terms of population pressures and climate change. And then share some promising approaches in family planning and girls' education. I hope I can show you a short video of about 2 minutes. We'll see if that works. If not, I'll just describe what we're doing with girls' ed, and then offer some ways to get involved. So, excuse me. This graph basically shows us at a quick glance the fact that human population on Earth remained below 1 billion for all of human history until basically the industrial age. And the easy way to explain it is that we started living longer and child survival improved as there were improvements in medicine, which is a great thing. I think nobody would say the contrary, but what it means is that this kind of growth curve is unsustainable, and really just shows you that there's just been massive changes. I mean, we know about so many technological advances that have happened in the last couple hundred years, but this is just a massive change in terms of humans' place on Earth and sort of the space that we are occupying and the demands we're making on Earth. For those of you who are familiar with the Sustainable Development Goals, this is some work from Ellen Starbird. Sorry, the reference is a bit hard to see. But analyzing how family planning, especially through by voluntary family planning, slowing population growth, there can be all of these benefits and peace, prosperity, dignity for people like education, health, food, then partnerships and the planet, of course. So the initiative that I started at UC Berkeley, and I know for the last 5 years have been running a nonprofit organization called Oasis. We are advancing education and choice for women and girls in the Sahel. And we can imagine a place, as Sahel, being a place where girls are educated and free from being married early, and where women are free to choose the timing and number of their children, and where everyone has enough to eat. So many of you are familiar with this region already, but here's a satellite image of it. I think this is really beautiful. And for those of you in Israel, hello, we see you there in the corner. And so it's really the Arabic word for shore, and it's really where the Sahara Desert turns more green, just to the south of it. So it's that really widest strip across the African continent. And here's a political map from a paper that some colleagues and I, a comment that we put in Nature last year. So of course it's an ecological zone defined by its rainfall, so that it's a little messy to map it out. But the next few slides are from that paper. And so the countries that were included in the analysis are named here. In northern Nigeria, I mean, for those, I know we have one panelist from Nigeria. For anyone maybe who's not so familiar, the country is vast, it has a huge population, and it has some great differences between the south and the north. And one of them, of course, is the ecosystem. So it's drier in the north. And the basic measures around women's health and empowerment are much worse in the north in terms of education, health outcomes, age of marriage, decision-making power in the home, etc. So the Sahel is, this is the air surface temperature in Niger from the IPCC, and very unfortunately, tragically, the temperature is increasing in the Sahel, especially in central Sahel like Niger, much more rapidly even than the rest of the world. So by mid-century, it's projected to increase by about 3 degrees Celsius. Already it's a very hot and dry climate, so this, excuse me, is going to be very difficult to sustain human and animal life. And one paper I'm familiar with, my background, by the way, is in public health, but one paper I'm familiar with, it concluded that there will be robust negative effects on the cereal crops in the Sahel by mid-century due to this climate change. And here is cereal production per capita historically. One of the co-authors of that paper is a specialist in irrigation and adaptation, and this estimate, now I'm not remembering if it is Lorenzo's or one of his colleagues, but anyhow, we can see that there is hope, with better inputs and better access to irrigation, there could be improvements in the yield. This is what caught my attention many years ago, and I always include it in my talks because to me it is, well, I'm sorry, it's a little bit hard to read, but hopefully you can see it. Can you see it? The words?
Yes.
We can see the words, it's fine.
Great. So this really caught my attention because in Niger and Chad, Chad, Mali, and Burkina, Central Sahel tend to have some of these worst outcomes in northern Nigeria for girls and women. But only 1% of women don't fall into one of these categories. And to me, it's hard to imagine a country really on a path to development when half of the population is lacking basic decision powers in their lives. The average fertility in Niger is the highest in the world at 7.6 children per woman. Across the Sahel countries that I showed in the political map earlier, it's just over 5. Because fertility is so high, population is growing very rapidly. The last that I looked, it was growing at 3.9% per year. So that means that the population will double about every 20 years. And by the middle of this, by mid-century, the population will increase in Niger. It's projected to increase by about 2.5 times. And as you know, for those of you working in environment or anyone working in nutrition, this statistic of, nearly half of children under 5 being stunted and not growing to their physical or mental capacity is devastating. Okay, on to the more positive part of this talk. The good news is that there is, okay, so like most of sub-Saharan Africa, there's a desire for large families. However, there are more women who say they want to space or stay spaced by 2 years or stop bearing children than there are women who are currently using contraception. So that means that there's a huge untapped potential to introduce this method, modern methods of contraception to women in the region. And so this is data from the most recent demographic and health surveys. And we know what can work. We know that voluntary family planning policies and programs can be hugely effective in bringing down fertility in a way that respects women and couples' rights. And actually, I usually like to, but before going to the slide, ask people which country has had the fastest fertility decline, and people are very surprised that it's Iran. Iran had so from these countries, China, I think most of us would agree that the one-child policy doesn't respect people's rights and is kind of off the table for me. But you should know about China that the fertility was falling really fast before they even introduced that. In Iran and Thailand, so we can take some lessons learned. I want to be cognizant of the time. Just very quickly, I would say there was political will. That's hugely important. The government wanted to make sure that everybody had access to family planning. There were big community efforts. There are major efforts to get family planning available at the community level. And that means tapping into community health workers. Doctors and nurses don't want to go out to rural areas to talk to families about family planning, but people from the villages, from the communities can be trained. Even illiterate people can be trained to counsel on family planning and even offer a variety of methods, obviously pills, condoms, and now there's a ton of support for the 3-month injectable contraceptive. Many people know it as Depo-Provera, offered by community workers, or even women themselves can learn to inject it. So anyhow, we can take lessons from these countries. And moving on, Alon asked me to talk about what's working. I think there's a long way to go in the Sahel, but I wanted to, well, anyhow, this is from the Ouagadougou Partnership. It's a partnership of governments, especially ministries of health, from the Sahel and West Africa region. So now we don't overlap exactly with the countries that I showed you earlier. These include some coastal West African countries. But what I think is really encouraging is, with the government commitments, partnering with donors, mostly from the US, private foundations, also USAID, and some European donors, with a really concerted effort, they increased the number of new users by about 2.2 million in 6 years. And so you can see, so now I'm sharing my screen. So are your pictures over on the side? I bet you I can figure that how to do that. There we go. So you can see that, they were able to increase the number of new users by more than what would have been expected if it continued in the same path. And I think that that's really impressive. Again, it's about garnering political will and putting more investment into what we know works, like the community distribution, for example. But speaking of investment, globally, the amount of international aid that goes for family planning is just 1%. And in the aid to the Sahel countries, it's even less. Part of that is because the United States is the biggest family planning donor by far. And we don't have the kind of ties. It's probably not as politically interesting for us to give large amounts of aid to these countries. We know that with more investment, major changes can be made, both in terms of allowing women to separate sex from large families, but also on all of the development fronts that I showed you in the earlier slide. So we're organizing a conference to especially appeal to the European donors to invest more in girls' education and family planning. Why girls' education? Because it's a basic human right, it's a basic good for girls and their families. It also contributes to slowing population growth in high fertility countries with early marriage, which is the case in the Sahel countries that I've mentioned. So since I took over this this organization based in Berkeley, it's a nonprofit organization. We've been partnering very closely with a group, an organization in northern Nigeria, in Zaria. In fact, we get, well, anyhow, without going too much into the history, you know, that initial effort was meant to address high rates of maternal death, maternal mortality. And through ethnographic research, through careful research, we learned that early marriage and childbearing is really contributing to it. So our research assistants asked the families what would be really the alternative to early marriage. And of course, all the families say school, but the quality of education is so bad that it doesn't make sense for parents to pay the cost and opportunity cost to keep their girls in school, because they're not seeing, you know, the girls finish primary school and they can barely read and write. So we, for a while now, we've been working with this organization on safe space programming, and that's mentored girls clubs. And among the girls who participate in our safe space programs, the completion rate of secondary school increased from 4% to 82%. That's in Kaduna State in northern Nigeria. And I can provide the references. I'm sorry, I didn't carefully reference this. The age of marriage increased from about 15 to 17 and a half. So 2.5 years in an adolescent girl's life is huge, both in terms of their physical development, but also they have that time to grow, to learn how to negotiate their lives and kind of think about what they want for themselves, as opposed to, you know, being married essentially as a kid. Malala Yousafzai, who some of you will know as the girls' education activist from Pakistan, invited some of our girls, because now her foundation supports some of our work. She invited them to receive the Nobel Prize with her some years ago, and that's where this photo was taken. So Alon, let me know, do I have 2 minutes to try to play this video?
Yes, 2 minutes to wrap up would work just well.
Okay.
In the rural northern Nigerian communities served by the Center for Girls' Education, early marriage and pregnancy greatly limit the life prospects of many adolescent girls. Staying in school opens a new path.
Through education, you'll be able to reduce a lot of problems of women. Child morbidity, maternal mortality, sickness, diseases, and the rest.
The center pays for school fees that many families cannot afford. It's created village girls' clubs called Safe Spaces, where mentors provide tutoring in English, math, and skills the girls need for successful lives.
We teach them numeracy and literacy and life skills, even cooking, a lot of things.
We're trying to make them have confidence, make them be able to speak for themselves.
Ta yadda nake ganin gama secondary na zai taimaka min da rayuwa na shi idan na gama mafifa kuma zan matar da tarbiyyar da ƴaƴana a beke kuma sannan idan suka je makaranta za a iya ba su wani abu haka su kawo kuma ni zan musu ƴan gida mara su kawo musu.
I believe that an educated mother will never want her own child not to be educated. Poverty will reduce, people will be healthy, and children will not die. One day, we will wake up to our dreams. Everybody is striving towards educating his or her child.
Can you hear me?
Yes.
Okay, so 2 quick things. One of them is, you know, the pathways through which education contributes to slowing population growth. You probably can guess it, but girls tend to get married later. So start bearing children later. They tend to be more, have more decision-making role in their household. They tend to be better connected to health services where they will have a chance to learn about family planning. And they tend to be more likely to want to work outside of the home, which would, you know, maybe not necessitate, but would be easier if they have smaller families. So for all of those reasons, you know, girls in the Sahel countries on average who finish secondary school have 2 to 3 children fewer than girls who do not. So anyhow, that's it. I want to say that's a very glossy, beautiful video. And if you're like me, you'd be wondering how much that costs to produce. The World Bank produced that for us because they wanted to use it to teach safe space programming in other countries where they have the Sahel Women's Empowerment and Demographic Dividend. But unfortunately, we're not getting funding from the World Bank through that program or period. But it is a beautiful video. So with all that said, I'm always using conferences as a chance to get more attention to our work. Our website is on this page. That email address is mine, so it will go to me. You're welcome to contact me. We also have 3 to 4 times a year, we put out a short newsletter that we call, we send out through the Friends of the Sahel Network. So if you're interested in that, you can shoot an email there and just put Friends of Sahel in the address, and I'll know what to add you. And thanks very much for your time and attention, and I'll stop there.
Okay, well, thank you so much, Alicia. We're here on Zoom, but there's many more people who are watching it on the website and through the Facebook stream. But it's a terrific way that today's going to work is we're going to have the 4 panelists will speak, and then subsequent to that, we will have questions from the audience. And so I want to go right to our second speaker. Priscilla, do you think you might be able to open up your camera? Are we having connectivity problems? Can you hear me, Priscilla? Okay, so what I'll do, I'll move on to our next speaker and we'll call her up by phone. And I think what we'll do is, first of all, welcome to our one of our distinguished panelists, Dr. Mushira Abu Dia, who's joined us, like I said. And here's Priscilla, wonderful, just in time. So I'm again proud to introduce our next speaker, a PhD economist, a leading environmental leader, and a great women's leader and feminist from Nigeria. And Priscilla, the floor is yours. You there, Priscilla? Go right ahead. Priscilla, you're on. Priscilla, can you hear me? Raise your hand if you can hear me.
Hi, everyone. Okay, good evening. Can you let me share my screen with you?
It's open.
Yes, I can hear you very well. Can you see my screen?
We can see your screen.
Thank you very much, Tal. Thank you. It's a pleasure to be with all of you here, even though I was running. Can you hear me?
Yes.
Okay, good. Good evening. I'm going to be talking very much about Nigeria and the population and the challenges, what we have in the country. I just have a short presentation, and my presentation has to do with the introduction, causes of drivers of desertification, relationship between desertification and population, and ways to deconstruct population pressure, and then conclusion. Now, let me go by saying that according to the United Nations projection, Nigerian population growth rate for 2020 is about 2.58%. The drastic increase in population has led to take measures such as family planning to address this population growth. The total fertility rate in Nigeria is about 5.3%, with variations across states and regions. Note that Nigeria is a federation country with 36 states and the federal capital. So we have the federal capital, we have the 36 states and the 774 local government. The total demand for family planning among married women in Nigeria is about 36%. And this 36% is coming largely from the southern part of Nigeria, because in the northern part of Nigeria, it is believed that the more children you have, the better it is for the family growth. So the ratio of the population from the north and the South is also different when you look at it. I try to look at the major causes of land degradation, which is in the increase in population according to Mortimer Michael in 1993. The significant underlying the linkage between population growth and the process of ecological degradation is the population to land ratio. One of an increase in population density is necessary increase in food cultivation. When the density is low, the land remains fallow. Longer period of time allowing for the maintenance fertility and also for grazing and collection of wood, with an increase in the density of population areas of land to be cultivated. Now, let me digress a little from the paper presentation. In Nigeria, of course, scientists such as yours have stated that the desert encroachment from the far north into the middle belt is about 0.6 kilometers per annum. That's quite huge. And this is causing a lot of tension within the middle belt of Nigeria, where we have a lot of migration forced migration from the far northern part of Nigeria into the middle belt. You must have heard of the herders versus farmers crisis, which is a huge problem that we have in the country. And this is not an easy task. The various conflicts that is linked to this, nobody is talking about it. Desertification fuels deadly clashes in Nigeria. As I stated, the herders versus farmers conflict because of the drying up of the Lake Chad is also a challenge, because these people, most of them, their source of livelihoods were dependent upon the Lake Chad, such as fishery and farming. Now, because of the drying up of Lake Chad, most of them are now forced to migrate. And where they are migrating to is into the middle belt, where we still have a lot of green areas. And when they come to settle that, of course, they're coming with their herders. And so there's also so much pressure in the middle belt, and there's so much competition over these scarce resources. And so this is leading into a lot of crisis between the farmers and the herders across board. Now, what are the drivers of desertification? We have deforestation, we have soil erosion, we have population growth, we have overgrazing, then we have climate change. But the predominant one is that of the climate change, which most of the times is not linked to the issues of desertification. The weather variations, when you are talking about the drivers of desertification in the country and the various conflicts that we have, nobody really links it, try to link it to climate change. Because when you talk about climate change seems to be an abstract thing, very scientific thing that most of the people don't understand what climate change is all about. Like today, I was discussing with some journalists and I was asking them, do they understand what climate change is? And some of them gave different meanings. And I was saying that, okay, as journalists, we're supposed to go out and create awareness and sensitize the citizen about the impacts of climate change. But now, because you don't have that good knowledge of climate change, it means that you cannot give what you don't have. So issues of population linked to climate change, soil erosion, deforestation, overgrazing are key issues that need to be looked at, and these are drivers of desertification. Now, what is the relationship between desertification and population? As I said, migration. Scarcity of fertile land causes people to migrate, thereby increasing population. What we have in Nigeria is that most of the people from the northern part of Nigeria are migrating into the cities, and some of them semi-urban cities, and therefore there's so much pressure, even on the cities that we have and the already scarce resources that are there. Competition over resources as overpopulation. Much of the fighting is understood to stem from conflict over resources such as land and water, which have become increasingly scarce in Africa's most populous nation, which is Nigeria. Clashes are reported to have intensified over land over a few years now. And that is happening within the middle belt of Nigeria. Now we have a land act use that was promulgated in the 1970s, which has not been repealed up to now, has not been reviewed. The members of the parliament at one point tried to review that, but there's so much resistance. And again, the Land Use Act has vested so much power at the state level, that is the subnational level of Nigeria. So even the federal government does not have much power over land at the subnational. Unless the governors give you access to land, you cannot do anything. And then we have community lands, which of course, they said all lands are vested in government, which hold in trust for the people, but that is not the issue. So this is also one of the issues that we have. The government came up with a law, which they call it RUGA. RUGA means where every state we have a portion of land allocated to the herders, specifically for grazing. And there's so much resistance because the people are saying that grazing or herders is also a business. So if they want to do business, the government cannot take people's land and allocate to them for grazing, that they have to pay for it. If they want to have grazing land, they need to have to pay for it. The issues of desertification is increasingly rendering large parts of fertile land, like we have in the southern part of Nigeria. You have gully erosion, and from the far north part of Nigeria, you have a lot of that it's not fertile for anything any longer. And that is one of the things that a lot of people have been forced to move. Environmentally, it says that more than 6% of Nigeria's land have been affected by the issues of desertification. The report cites climatic variation and result of human activities, including deforestation, extensive cultivation and grazing, which I've already talked about, and unavailability of alternative sources of energy. The drylands have also increased the demand for fuel wood as population is increasing and thus leading to the degradation of land. We have serious issue of felling of trees. In the northern part of Nigeria now, we don't even have trees. So the trees that we have in the middle belt and southern part of Nigeria are not being felled, and of course, being transported to the far northern part of Nigeria for fuel wood and for other activities, while looking for logging and exportation. It's a huge challenge which we have at the moment. Now, how can we, what are the ways that we can discuss about population pressure? I think that most of the things, one of the key things that we need to do is awareness creation on impact of overpopulation, because if we begin to create awareness, especially in the rural areas and amongst the communities, this will go a long way, telling them the implications of overpopulation, the implication of child spacing. This will go a long way in helping, because like I said, Nigeria is a multicultural country, and of course, several ethnic groups. We have over 500 ethnic groups. And of course, the religious aspect of this, some people feel that they cannot do population, population control because of their culture or because of their religion. And this is a huge challenge. So there is a need to create a lot of awareness among such people, although at the moment, because of the poverty, some of them are beginning to realize that there is a need to do some kind of population, control, but others don't think that is necessary. The issues of sustainable agricultural practices such as agroforestry is also very important. Some of us, when we're growing up, we have what we call the agricultural extensive workers who used to interact from the government, who used to interact with farmers to give them information about what is happening. At the moment, we see that most of the agricultural extension workers don't even know some of the issues that are happening, especially in the area of climate change. And therefore, we feel that these practices need to be revisited, because if we revisit this kind of practices, it will go a long way. Planting more trees. I know that Nigeria, the president of Nigeria during the 74th United Nations General Assembly talked about planting of 25 million trees across the country. Now,
well, I just
25 million trees, we don't know how far it has gone, although I work with the ministry, and part of the challenge we're facing is that these trees has to be planted at the state level. So how do we get the statistics of the trees that have been planted? So the issues of data comes in here again, but I think that there is the need to create more awareness on how people can plant more trees. Improving the quality of the soil by reducing grazing. This is also one of the areas that I feel that we need to look at it. Land use planning, use of alternative sources of energy to prevent the deforestation. The larger part of Nigeria depends on fuel wood. And this is a big challenge, especially the rural population. And so we need to look at alternative sources of cooking or of doing businesses, because you discover that even businesses such as baking and the rest of them, they are solely dependent upon fuel wood. So I am saying that there is a need to look at the issues of alternative sources of energy, such as clean cook stoves, which is something that my organization has been promoting over the years. And of course, we have done quite extensive on that. Now, in my conclusion, I just want to look at it from the fact that there's the need, if we must really look at the issue, tackle the issues of desertification. We need to stabilize population growth, which is a key to tackling desertification. Providing men and women with family planning will slow the population growth rate and therefore contribute to reduced rates of deforestation, desertification, and land degradation. Why did I bring men in here? Because even if the women want to do family planning and the men are not keen into it, it will not work. So the issue of bringing in men and women about the issues of family planning is very important. Remember that I talk about the issues of culture. Some people feel that, our culture does not permit family planning. So why do we have to take pills or do anything? And so there's the need, if we really need to deconstruct this, the men have to be part of it. We call it the he for she. They need to drive this process. Family planning will mitigate the effects of harmful practices, interactions amongst human, domestic animals, and wildlife. There is also need to bridge the gap between the formulation of policy and strategies to combat desertification, so that government efforts of combating desertification can be productive. Nigeria has an agency called the National Great Green Wall, which cuts across 11 states in Nigeria. And part of the work they're supposed to do, part of their mandate is to combat desertification through programs providing livelihoods for the people, but also planting of trees and so many others. The issue is that how can we make this agency effective? And these are some of the things that I feel that we need to look at. Thank you very much.
Thank you so much. On behalf of us all. Now, I want to, maybe you can free up the screen. I don't think the next speakers have PowerPoint, so we can sort of go to a full screen and have a conversation. Do you have the, if you can unshare the screen, Priscilla, that would be good. Maybe I can do great. So my question then would be, is if Dr. Mushira Abudia feels that she is ready to speak, or we can have Daphna speak if you'd rather wrap it up and still have the chance. What would be your preference?
Whatever you choose, I don't.
So Daphna, why don't you speak now, and then they'll give her a chance to wrap it up completely and catch her breath, having joined us late from the hospital.
Okay. PowerPoint I want to share.
Okay, you're able to share. The screen share is yours.
Perfect.
Priscilla, you will have many questions, and they will be answered. We're going to wait till everybody finishes their presentations first. Okay.
Just a minute. For some reason, I cannot share now.
Check. You should be able to share.
Yes, but oh, there it is. Okay. All right, so I will look at Israel, which presents a very different yet similar landscape to the African landscape that we have just encountered. So I guess you're all familiar with these typical graphs that show that with child survival, women give birth to fewer children. We see Israel here standing out as having a very low rate of child mortality or a very high child survival, it still have many, many children, more than other people in the same situation, other women. The same would apply when we look at women's income. And we see again that Israel stands out for the level of income that other women would have, who would have much fewer children if they had the same kind of personal income. We should see that if you are curious about these countries, then it's Oman, Saudi Arabia, and Kuwait, which have a very high GDP income level and still very many children. And again, Israel stands out. We see that with women's education, as women's education goes up, the number of children normally goes down. It is true also for Israel, but the balance or the endpoint is at a much, much higher level of reproduction. Israeli women have roughly or even more than 3 children per woman. Now we see that generally with development, fertility first drops and then rises a little bit. This was true also in the case of Israel, only again we see that the whole scene takes place at a much higher level. So again, Israeli women would have many, many more children than their counterparts in other countries, which is very consistent and is kind of an enigma. Now, of course, we know that fertility is very context dependent. If we look at this figure from the USSR, we see that fertility has really declined with the economic situation, political unrest, etc., and then rose a little bit afterwards when things calmed down. If we look at this diagram, we see women immigrants in France, and we see that they are at a higher level of fertility, but their fertility declines in a way that is very much parallel to those of the local women. A very similar process, though in a different direction, takes place in Israel. I apologize that this is in Hebrew, but when we look at women who emigrated from the former Soviet Union to Israel, then in 2005, they had 1.62 children per woman. But 10 years later, they already had 1 child more, which means that Israel is a very, very pronatalist and encourages birth in all its sections. Now, or subpopulations. Now, if we look at many times, let me say that many times people would say, well, this is Jewish religion, be fruitful and multiply, you can't help it, it's religious, there's nothing we can do to interfere. But when we compare US Jewish communities to Israel, we see that at all levels of religiosity, Israeli women have more children than their American counterparts. And this is especially prominent when we look at the Orthodox women who have 4.1 children in the US, but 7.1 in Israel. So again, in sharp contrast to the African situation in which the state encourages a decline in fertility. In Israel, the situation is pretty much the opposite. Now, Israelis largely believe that childless people live empty lives, that raising one's child is life's greatest joy. So, of course, it is very, very difficult to even introduce the idea of reducing one's fertility. And again, if we look at this graph, we see that Israel again stands out in its total fertility rate, because if we look at other industrialized countries, they mostly fall below the reproduction level. Whereas in Israel, we see that there is a very, very high excess above this line. All right, now as for the population density, it's not as if we have a huge amount of land in this country. The population density in Israel is roughly 400 people per square kilometer. Is this a lot? Is this not a lot? We see that Israel is somewhere around here between Belgium and Netherlands. So we say, okay, so that's not so bad, right? You know that both Belgium and Netherlands have a very high quality of living in this dense situation. However, if we look at the average, then the European average is less than 10%. It's like 8% that of Israel. And which is more important, if we compare the Netherlands with Israel, we see that the fertility rate is roughly double in Israel as compared to the Netherlands, which means that Israel will very, very soon overtake the Netherlands or any other state upon the earth, in fact, or at least industrialized country in terms of density. Now, I think that this graph, although it shows the very same trend, but it's really striking, because if you look at Israel here, and this graph shows you the population density per square kilometer, and you can see that from the year 1960 to the present, 2050, which is not that far away, just look at the process that the state of Israel has undergone. I mean, this is completely unparalleled. I mean, the rise is just inconceivable, really. All right, and this is not really surprising, because if we look at Israel's population by date, we see that not only is the number of people rising very quickly, if we look at the last decade, which was not characterized by any massive immigration, which we did know in previous years, this is more or less the steady state. Without massive immigration, just look at the rise in population, which is really tremendous. Okay, again, the urban areas are also extremely populated and dense in Israel. And of course, the forecast is alarming, because if we look at the population forecast for Israel, then we see that we are today here in 2020, somewhere around here, but it remains to be seen whether the population will rise or soar so quickly or a little bit slower. But in any event, we are today roughly 9 million people in Israel. We are looking at doubling the country's population in a matter of 40 years. Again, this is a long period of time, but it's not an eternity. And just imagine, I mean, you probably are not well acquainted with Israel, but the place is very, very dense. And if you think that next to every car standing in a traffic jam, there would be another car. Next to every patient in the healthcare system, there would be sitting another health patient. The forecast is really alarming. Now, if we look at Israel's subpopulation groups, we see that Muslims' fertility from the 60s to the present has dropped very dramatically. For Druze, the same, from 7.5 to less to roughly 2 children. The same for Christians. And only the Jewish population has actually gone up in recent years. Now, this is a very, very significant and, in effect, disquieting process, because we see that, again, though the density is rising so steeply, Jewish women keep producing more and more children. And this is true, in fact, at all levels of education and income. In other words, in Israel, wealthy women are also having many children, even though they are very well educated, even though they are working more hours than their counterparts in Europe or in the United States. Still, the alpha female in Israel would have many children, would have a career, and preferably would look like a model, of course. Okay, I will skip these internal issues. I would only say that among single Israeli women, the fertility rates are also going up. Even posthumous assisted reproduction is accepted in Israel. Israel, to my knowledge, is the only country in the world where courts have approved the right to genetic grandparenthood, which means that people or parents whose child, mostly a son, died early, have the right to extract his sperm or use his sperm if he had deposited sperm before his death. I see that Alicia is very surprised, but this is the case. Now, of course, this doesn't have any significance in terms of numbers, but it has a great significance in terms of the social discourse, because it says that reproduction is the utmost and most important life goal anyone could aspire to. And in this kind of social climate, everyone wants to have as many children as possible, really. Okay, when we look at in vitro fertilization policy, when we look at fertility treatments, then again, Israel is unparalleled. If we look at the graphs, we see that the numbers are soaring, so we can say, okay, this has happened all over the world. However, Israel has been the world champion in IVF, number of IVF cycles per capita for decades, really. And Israel always leads in I would say 100%. I mean, Israel has normally double the number of IVF cycles per capita, as does the second country in line, which would normally be one of the Scandinavian countries. And you see the numbers, it's 5,300 as opposed to 2,600. All right, women are very keen and very, I would say, adamant about the right to reproductive treatments. Israel is, I believe, the only country in the world where women would undergo 20 or 30 or even more IVF cycles. All of them would be state-funded one way or another. Women are entitled to have 2 children with their present partner, which means that a woman who have had 4 children from a previous marriage and her husband, partner would have many, many children, could still have as many IVF cycles as they want in order to produce their joint children. I'm not saying that it's bad, I'm just saying that it's very pronatalist. This is a headline subtitle telling everyone that the number of women who have had their eggs frozen has gone up in Israel by 10. Okay, it has gone up tenfold within 6 years. So this is major news. Another one or another title, look at that. Okay, this has nothing to do with fertility, but when you look at the small letters, it says, this is the dreams house of a family with 5 children in the center of the country, which means that when you are really prosperous, having many children is part of the landscape, part of the mise-en-scène. You need to have many children in order to be really, really wealthy. These are numbers of all kinds of celebrities who have an enormous number of children. This is a television celebrity, I would say, or journalist, very well known, now married to a senior politician, and she says, I've always wanted many children. I admire women who have many children. I worship every woman who succeeds to have a career that is so demanding, and especially, to raise so many children and have such a career. Well, she's now having her 5th child, and of course, she looks the way she looks. This is the miracle of Israeli birth, and of course, in every New Year's Eve and Independence Day, the newspapers would tell us how many Israelis have been added to the local population since the previous year. So it means that the state actually celebrates the population growth, which is a major problem, because this is what the future looks like. So if you look at Israel, then this is the Israeli trajectory, as opposed to very populated countries like Holland, Belgium, or South Korea. So this is a very worrying line, I would say. But again, this is under the auspices of the state, and the state actually encourages this trend, because talking about family planning in a way is a taboo in Israel. You talk about family planning and you start hearing about the Holocaust and all our enemies, etc., etc. So thank you very much.
Thank you, Daphna. And give us back our screen, and we will have our last and final panelists and move on to questions. I want to thank particularly Dr. Moshira Abudia for joining us. As I said, you weren't here when I introduced you, but a physician, a staff doctor on Hadassah medical staff, and also chair of Israel's Physicians for Human Rights. I hope I got the title more or less right. And we're so grateful for you to join, to maybe wrap it up and to have your perspective as a medical professional, as a woman and a human rights leader in some of these challenges. So
okay, let me just share.
It's interesting, you know, we all, I told the panelists, nobody has to make a PowerPoint, but it's something that we do. And I'm looking forward to seeing your talk.
If I ever get to find it. Just a minute.
Work on your, take your time.
Just a minute. Okay. I'm trying to get to my mailbox, but I don't see that I
If you leave Zoom, sometimes you can reduce and then open your mailbox, it'll pop up to the top of your screen. That's been my experience.
Maybe I'll open it on PowerPoint, and then I'm sorry for the delay. Just a minute.
Don't worry about it. It's fine. We're all eager to hear what you say and have plenty of patience. So the truth of the matter is that this is one of the great paradoxes of this complicated time we're living in, that on the one hand, a conference that I helped found several years ago and brought many people together is not, we can't reconvene. On the other hand, the ability to put together many sessions and to engage people who wouldn't have the time to come out for a week to have a talk is also increased. So you have to maybe see the both sides of it. I think I'd prefer to have life as real, but I'm very glad we could convene this gathering all the same.
Okay. No luck. So I'll talk.
We can do is
I guess I'll open it on the computer, and I'm sorry I can't. But I.
Would you like to take a minute? We'll take a question for one of the speakers, and while we're doing that, you can be looking for the PowerPoint. And then you come back.
No, I opened it on PowerPoint, but for some reason it doesn't. It doesn't enable me to share from the PowerPoint. That's why. So.
Oh, I'm so sorry.
No. I don't think it. Okay, so I'll just talk.
Old-fashioned.
So thank you, first of all, for letting me, for inviting me to speak. I think it's a very important panel and subject. And although I'm a gynecologist and obstetrician, and my everyday life doesn't revolve around climate, like environmental issues, I do follow up closely what's happening in the world, and pretty worried about what's happening. And I remember that I heard the first the word desertification for the first time when I was visiting. I was coming back from Nepal, and I went through Delhi to visit a friend, and he was talking about it. And for some reason, it seemed strange because I'm not familiar with the terms. that he said that Delhi is going through desertification processes. And actually, only after reading it, I do understand that a city as industrialized and as heavy populated as Delhi can go through desertification processes along with other areas in the world. So Professor Carmeli had made a great presentation and talked about all the statistics about Israel. So I don't need to present the OECD chart that shows that actually we're the state with the highest fertility rate among all the OECD countries. So to the best of my knowledge, there isn't any clinic for family planning run by the state in different parts of the country, and something that should be done. So actually the opportunity to try and talk about family planning and give contraception to a patient is done at the gynecology clinic, where a woman comes either for a lot of other reasons, but this is an opportunity to talk about it. I usually suggest contraception or talking about family planning to every woman who comes for a postpartum visit after the delivery. We prescribe contraception. Contraception can be the pills. It can be intrauterine contraceptive device, either a patch, injection, or ring. These are the prescribed. And there are others that can be, of course, condoms or other barrier contraception. The important thing in this visit in the gynecologic office is, first of all, to give the information on each method and to be very, as much as very informative about it, just to enable the patient and a consent, making a choice out of understanding what are the options that are put in front of her, and then choosing. Aside from the information, of course, information about side effects or things that might happen and how to use the contraception appropriately, which is a very, very important thing. Actually, every visit like that entails tailoring the use of contraceptive method to every woman individually, because every woman is different. She has a different lifestyle. She has a different way to comply to the treatment, and that's something that should be should be addressed in this meeting, in this visit. Of course, follow-up is very important after she gets the contraception, just to make sure that she's compliant, that she's satisfied, that she didn't develop any side effects, and she wants to continue with the contraception. I will talk specifically about certain populations in Israel. I was asked to talk about cultural differences. So we have, in Jerusalem at least, we have a very big, Jerusalem and Beit Shemesh, where I work in Kupat Cholim, we have a very big ultra-Orthodox population, and of course an Arab population, Palestinian population in East Jerusalem. And both of them are very traditional patriarchal societies with in which contraception and family planning might be considered a taboo. I'm talking about the Arab population, where in some of the villages that I worked in East Jerusalem, girls are getting married at the age of 15 or 16, even though it's not illegal in Israel. Some of them get pregnant already at this age, and this is something. And of course, so pregnancies with teenagers, which we see a lot of over there. In the ultra-Orthodox society, we have actually a population that goes after that is subjected to decisions being taken by high religious authorities. And a lot of times when a woman would come to a postpartum visit or to ask about contraception, she will have to consult her rabbi, and he will decide which contraception she's going to take and for how long. And this is something that for me is a bit hard to accept, but this is what I have to deal with and try to work with that in order to enable her that family planning she wants. Of course, in those specific populations, there's lack of programs on sex education at school because sex before marriage or family planning, it's not something that you talk in the age of school children or high school children. And I see a lot of ignorance about contraceptive methods and their effect on future fertility. Among my patients, I'm not talking about teenagers or other people, and this is something that needs to be addressed in order to dismantle this fear of using contraception that some of the people have. As you said, I'm the chair of the Physician for Human Rights. I started there as a volunteer. I still volunteer there. I do clinics in the Open Clinic, which is a clinic that is based in Jaffa and gives services to residents with no status, with no health insurance in Israel, and also all the refugees, asylum seekers, and this is also a special population. One might think that there are not a lot of people, but we're talking in Israel, all the people without any legal status or citizenship are about 250,000, which is a lot. And if we think about the fact that half of them might be women, then we talk about more than 100,000 women that need their needs to be addressed, also like family planning, among other things. So those people don't have medical insurance, and therefore they have less accessibility to clinics. Like if I see my patients who are citizens and have medical insurance in Kupot Cholim, there are only two clinics that are based on volunteers. It's our clinic, the Open Clinic, and Terem Clinic at the Central Bus Station in Tel Aviv. And it's very hard to deal with like a lot of women who need to be taken care of, but no, I mean, there are not enough people or manpower in the volunteer clinics to deal with it. This is one challenge, this is one problem. The other problem is the information on contraception methods that needs to be available in different languages. Some of them speak languages that are not, and there are not like official languages here in Israel, or are not familiar, and therefore their ability to access information about contraception and family planning is limited. A lot of times I would sit in the clinic and I would sit with a translator because it's very, because if we don't speak the same language, it's very important for me, as I said, to give all the information about side effects and way to use contraception. And it's really hard to do when you don't have a common language with the patient. These are also like people who work, if they work hard for the living, they don't have enough money, and sometimes they need to pay for basic health services, and paying for contraception is something that might be very hard for a lot of them. And also there's a problem with lack of follow-up, because as I said, there are not a lot of available health services for this population, and sometimes when they need to follow up, when they need to come back to after they got the contraception, it doesn't always happen. I remember specifically one patient that I gave her pills, and I thought that she understood how to use it, and the next time I saw her was a few months later. She came with bleeding, and she didn't understand why she's bleeding when she uses the contraception, but she uses it only before intercourse. I mean, it wasn't on a daily use. And this is like, these are things that's it's very important to make sure that the patient understands what she needs to do. Another issue that I want to address here is termination of pregnancy here in Israel. So termination of pregnancy, in my eyes, as obstetrician and gynecologist, is something that should be available to every woman that wants it. In Israel, there's a medical termination of pregnancy, use of medications, until between 7 and 9 weeks. It depends on the hospital and on the institution. And the surgical, which is curettage, that is done in hospitals and private clinics, is until 17, 18 weeks. A woman that wants to have a termination of pregnancy needs to have an approval of a committee, and that's and there are strict criteria about who the women who can have terminations of pregnancy. Of course, there are like private clinics, but they also go according to a committee. And the problem with that is, if I'm talking about a population that is poor and have no means, it's very hard to pay for private clinics. And when I'm talking, I'm addressing also the population of people with no medical insurance that don't have any other way than paying the private clinics because they can't do it in a hospital, but also people from weaker socioeconomic levels that have difficulty of approaching the termination of pregnancies committees. When I talk about availability, I would also mention that we do also work in the West Bank and the occupied territories, and there the situation is much graver because sometimes it's a very problematic issue. Termination of pregnancy is a very problematic issue in a very traditional society like the Palestinian society. There are not a lot of doctors who are willing to help a woman who got into an unwanted pregnancy. And an unwanted pregnancy in the Arab society can mean like that she might be risking her life, because if somebody finds out that it was out of, like, she's not unmarried and she's pregnant, it might be end up with honor killing. So all those things are very sensitive and need to be addressed. And if I want to wrap up and say what could be done about those some of the things. So first of all, I think that we should create family planning programs and clinics in Israel, a service that should be free and include medical, social, and psychological consultation available. I think it should be the responsibility of the state of Israel and not necessarily relying on NGOs like Ladat, Livchor Nachon, or Delet Ptucha in Tel Aviv, which are NGO who make the information about contraception available to all people from the population, including teenagers who need really guidance like in this area. And it should be accessible in all languages. Another thing that should be that we should work on is including all contraception methods in the basket of health services with no charge. The absurd thing about that exists in Israel today is that you can have the medications for termination of pregnancy are included in a basket of health services, but not the contraception. And I think that should be the other way around. Like we should think about preventive medicine before and not think that once the woman or a girl has an unwanted pregnancy, she can get it for free. And we also need to work on education about family planning, and contraception should start at least high schools, I think before, but at least high schools, and make serious plans that educate, major education that deals with family planning and contraception. I also think Professor Carmeli said about condemning women who don't want to have children. I think that we should change the dialogue here in Israel, because we're a country that sanctifies procreation and bringing children, but we don't. And I think that women who feel different about it and don't want to have children should have a place and should be respected. And that's it for today. Thank you.
For a bit of discussion and questions. Dr. Noah Avril Avni, if I hope she's still with us. She put in the first question via chat, and I promised her that she'd be able to ask it. Are you there, Noah? Okay, maybe she'll be coming back soon. I'd like to pose a question, which I think was put in there, but it goes to the point that Priscilla raised, and that is the role of men, and indeed, because we have a panel which, for whatever reason, was not gender balanced. That's my mistake, maybe. But I'm wondering, clearly, there's many studies which suggest that maybe the best predictor about what family size is not only a woman's desire for children, but to what extent she has support from the husband's side, and what do you think can be done to increase my gender's support for women's reproductive autonomy? So that goes for all of you in all the very different social contexts. Priscilla, if you want to come on with that, and Liz, you want to get started, and then we'll hear, please. Just I'm going to unmute everybody if I can. But
I'm going to unmute myself, and Alon and everyone I was just putting in the chat. I'm really sorry. I have a 9:30 work retreat that I'm leading, so I have to go. It's 9:20 here, but I want to say thank you. Yes, there are, regarding the boys and men efforts in the Sahel, one thing I'm familiar with is something called husband schools, and now they're calling it schools for future husbands, to try to implicate and get interest and support from men for men and let's say adolescent boys for their wives, and in terms of access to health services generally, decision making, even they touch on empowerment issues like making decisions about household income, etc. But family planning is part of that, and I am just so honored to be part of this panel. It's really excellent. I've learned a lot. Thank you very much, and I wish you all the best. And sorry that I have to leave a little bit early.
Please don't. Have a great retreat.
Thank
Priscilla,
you.
we're back to you. If you just need to unmute though, as you move, so we can hear you. Just, I don't know if I can unmute you, but if you could get rid of your mute, then we will be able to get your response. Priscilla, are you gonna unmute? Maybe she can't hear me. So Daphna, to you then, and then we'll have Moshe, and by then maybe Priscilla will be back with us. Go right ahead.
All right, I will just quickly refer to two questions that were posted here on the chat. All right, I mean, or let's start with your question about male partners. I think that for most Jewish women, it's not necessarily an issue of the men's pressure. On the contrary, I've recently learned that in many Orthodox circles, the men are quite reluctant about having so many children, because as we remember, the average number of children per woman is more than 7 children. And I heard that some men are very, very reluctant, and it's the women who actually compete with one another and want to have as many children as possible. So I'm not sure that in Israel it may be different, maybe in some Palestinian communities, but I think that in most Jewish circles, it comes first and foremost from the women's side. That's my impression. I don't have systematic knowledge, but that's my impression.
Okay, Moshe, would you like to address that, and we'll come back to some of the other questions?
I just think that the key is education, and the sooner the better, like education on this deconstructing gender roles in the society, and then maybe getting to that men would not be as encouraged to have so many children. I think that this is the way to tackle it now. Just education.
Right. Priscilla, can you hear me in Nigeria? And if so, unmute so we can have your feedback as well. Okay. So I'm going to ask Professor Daniel Ornstein from the Technion had a whole slew of questions during the course of that. Danny, are you with us to ask, or should we leave them off the screen? Your feedback as well.
Well, they're all for Priscilla as well.
Oh, she's with us now. Priscilla's back.
Okay.
Professor Daniel Einstein from the Technion had a whole slew of questions during the course of that. Danny, are you with us to ask?
There's a problem with the feedback, I think, from that. Priscilla, go ahead and answer, though. You can go ahead and speak.
Did she have a chance to read the questions? Or should I ask them?
There's a problem if you didn't close your website before you moved into this. And sometimes there's a feedback, and I think that's what's her situation is.
So my question for Priscilla was essentially that at least for the last couple decades, we've been reading research about desertification processes and population growth in the Sahel and sub-Saharan Africa. And my question was essentially, have there been any significant changes in the trends in the last few years? Like if it's just accelerating, or whether there are, promising signs of changes in these trends, if anything is essentially different and new in the last, say, 5-10 years.
Priscilla, if you can you unmute for that question, please? Okay, I think we'll have to go on to other questions.
Thank you to all the panelists.
Feel free.
For all the interesting talk.
Lena, did you have a question that you wanted to ask? Lena?
Yeah, thanks. So my question was for Daphne, and thank you so much. That was really, really like on the money. But is there any, are there any regulations from the Israeli government itself that helps the women get pregnant at this rate? Like, do they take maternity leave? You see that? Okay. So, wow.
One of the enigmas and really of the stronger indications that tell you how much it is driven by a more pervasive or fuzzy social discourse is that, maybe I'll try to mute.
I'm going to be muting people right across the board here.
Yeah. Is that, monetary allowances are not terribly high, maternity leave is not very long, child allowances are not very significant. So in this respect, the government doesn't have to invest a lot because women conceive on their own accord. So it's really a matter, I think, and I agree with Mushira that it's very, very much a matter of education, but it's not only family planning education. It's at a much, much deeper layer where you can conceive of a life that doesn't include so many children and still be meaningful. In Israel, having 2 children would normally invoke a question, and where is your third? Because it's an incomplete family. And it's this kind of comments that nurture not only the secular children who have relatively fewer children, say 3, but it trickles up, so to speak, to all other circles of women in Israel. Yeah, so it's not, but again, if the state funds fertility treatments practically with no limit, and at the same time, it doesn't fund contraception, it also conveys a very, very strong message, right? That, yes, and it also tells you that you need to have your own children. Otherwise, you wouldn't have to go to undertake 20 IVF cycles.
Exactly, yeah.
Okay.
Wow.
So it's very indirect, I think.
It's indirect, yeah. Well, thank you so much. Thank you.
Thank you.
Okay. I think we're about to run down. If anybody has another question, now's the last chance to open your microphone and ask our experts. Priscilla, I see you're unmiked. Do you have any response to some of the questions that came out? Okay. Well, we are great. Mushira, any concluding comments as we draw it to a close? Okay, well, I want to thank all of our panelists. This has been a enlightening experience, a technological triumph, especially Priscilla. Thank you for finding the time for coming back to us next year. We were going to bring you here, so we won't have to worry. She wrote us on the chat that she's dealing with a weak signal, but we'll have very strong signal when we see you next year in Israel. Moshe, a pleasure to meet you. Thank you for finding
Thank
time, Daphna. Always a